as the father of a 6-year-old little girl, it just greatly encourages me to know that there is increased discussion about how to improve the health care of our community, especially our children. Allergies are nothing more than an immune response to pathogens, to foreign substances. We produce antibodies every day to viruses and to bacteria. However, in an acute allergic reaction, this response in our body goes haywire. We have seen in our emergency department at Memorial children that come in with rashes, with swollen tongues, with swollen throats, decreased ability to breathe because of wheezing. Acute allergic reactions create a decrease in your blood pressure. All of these things concomitantly create something called anaphylactic shock and even death in patients. When we see kids, even in our local emergency department, at least 25 to 30 patients every month come in with some type of allergy. The typical response to treating these in the emergency department for minor reactions is Benadryl or Solumedrol, which is administered intravenously or through an oral pathway. But in these very, very acute, severe reactions, we actually use a medication called epinephrine. The beauty of a EpiPen is that this life-saving medication can be given in real time at the point of an allergic reaction's origination. And so patients don't have to wait for ambulances, they don't have to wait for lines in the emergency department. It is a medication that can be given by parents, by teachers, by anyone who's been given any type of training as to the administration of it. And it saves lives. It is one of those things which this bill does, is it empowers the community to take control of these very life-threatening situations and provide a critical way that our patients and our kids have access to life-saving interventions. So one of the most common concerns that parents and teachers have are, well, what happens if you give this medication to a child and they're not necessarily having an immune response? Well, the good news is that with children, all the side effects, which are really an elevation of their blood pressure and a little elevation of their heart rate, is very, very minimal. It's very, very short-acting. And so, especially in our pediatric populations, we would rather err on the side of caution and deliver that administration as soon as possible. So again, I just want to thank the good people that have been behind this legislation, because it really is a combination of sound judgment, of good intent, and excellent evidence-based medical care.
Thanks, Doctor.